my name is Mary Fatima El Sosa from BSNT 5A, and for this video I will be demonstrating on how to make a non-occupied bed. So the first step is to get all your materials ready, or gather all the necessary materials. I already have done that. Also, the next step is do hand hygiene. So you can use alcohol. And the next step should be adjusting the bed to the nurse's desirable height. So assuming that I already did that, just make sure that the bricks of the bed are locked so it will not move. And then if there are side rails, take it down. Okay, so the first step is to put on your gloves now. Okay, so after putting on the gloves, you can now put on the bottom sheet. Put it on all four corners of the bed. Make sure that it is neat. Okay, so the next step should be if your client needs a slider sheet and a pad, but I currently don't have that, and also my patient doesn't need it. So the next step should be put on the top sheet. Then after that, I now put on the blanket on top. Then do it parang yung ginawa sa top sheet. Then get the pillow and put on pillowcase. So the right way should be like sheet and the top blanket. And now you're done. That's it. And then after doing that, you can now remove your gloves and do hand hygiene again. That's it. Okay, hello everyone. I'm back. I am Mary Fatima El Sosa from T5 PSN T5A. So now I am done with bed making unoccupied. So now I will do the bed with a person in it. So the first step is to check the charts of the patient to see if they are physically limited or and then the next step is to gather all the necessary materials so that there are no unnecessary stretching and twisting of the muscles, and also it conserves time and energy. And then after doing that, you can now wash your hands, do hand hygiene, and put on PPE if needed. Okay, so after doing hand hygiene, you can now greet and identify your client. Hello sir, my name is Mary Fatima El Sosa. I will be your student nurse for today. May I please ask for your name and your birth date?
Carlos Taliwaga, May 11, 2007.
Okay, may I please see your wristband for verification? Okay, thank you. Okay, and then after greeting and identifying the client to make sure that we are doing the right intervention to the right patient, you will now have to explain the procedures that has to be done. Okay, so sir, for today I will be doing your bed. While you are and while doing this, you don't have to get up. I will just do your bed. So just make sure that you are comfortable. Is that okay?
Okay.
Okay. So after explaining to the patient what you are going to do, you can now put on you can now adjust the bed to your desirable height. Okay, so assuming that I already did that, you can now go on and put on your gloves. Make sure that there are no microorganisms, that the spread of microorganisms can be prevented. Okay, so assuming that we have side rails, so the side that I am going to do first, I will put down the side rails of the bed, and then ask the patient to lie on their side. So sir, pwede po ba kayong humiga patagilid? Then how na lang po kayo sa side rails doon? Assuming that there are side rails there. You of course help the client. Okay, so move this part of the top sheet and the blanket, and then take off the corners from this side. Then tuck it in so that it can be easy to pull off on the other side later. Okay. Take off your client's blanket and then leave the top sheet. Then fold it properly. And then put it on a laundry bin. Okay. Then after that, you can use disinfectant and then just spray it onto the bed. to make sure that the bed is clean. Then get your bottom sheet, the replacement, and then just put it on the corners, top and bottom. And then the rest, you can tuck it in again. Just make sure that the old and the new are not touching, so that there will be no contaminations. Okay, and then ask your patient to switch sides. Sir, can you please face over here now? Help your patient get on their side. Okay. Okay, just do the same thing. Put it in the laundry bin. Then take a new bed sheet and then just ask your patient to, "Sir, can you please lift your legs?" Okay, just get that. Again, disinfect the bed. Okay, just get the sheet from under. And then put it onto the bed. Excuse me. Wala na po kayong higa, sir. Then ask the patient to lie on their back now. Then get their top sheet. Kunin ko lang po. Then put this in the laundry bin. Replace the top sheet. Okay. Then put on the client's blanket. Now for the pillowcase, ask the patient to lift their head so we can get the pillow and then change the pillowcase. Sir, can you please lift up your head for side? Okay, back in the front. Then remove the pillowcase. Put its head. Sir, can you please lift up your hand? Okay, thank you. Okay. Now that you are done with changing their sheets and their pillowcases, you have to make sure that the side rails are up. Okay, now we are done with with doing the occupied bed making. So after this, you can now remove your gloves and do hand hygiene. Thank you.